Hello and welcome to Not Your Mother's Midlife Crisis. I'm Chris, and this is my co-host, Chris.
Hello, Chris. We are here to talk about surviving life as we age. And we are still coming to you live from Riley's bedroom, but we have a very special episode. In fact, this week we're going off our normal format yet again, but it's for a very important reason. And we are thrilled, beyond thrilled, to introduce you to Susan Federico, the owner and founder of Balanced Health. Hi, Susan.
Hi, how are you?
Hi, Susan. We're doing great. We're so happy to have you. Welcome to Not Your Mother's Midlife Crisis. And before we get started, could you tell everyone a little bit about you and what you do at Balanced Health?
Sure, absolutely. So my name's Susan Federico. I'm a women's health nurse practitioner. Just means that my nurse practitioner degree is a certification specifically in women's health. I opened Balanced Health almost 3 years ago now, specifically to serve perimenopause and menopausal women. As a nurse practitioner in traditional mainstream medicine, I worked in OBGYN. And I really found that I was not able to serve my patients in that demographic very well. So I had women coming to me all of the time with very classic perimenopause and menopausal symptoms, and the options to help them were just so limited in mainstream medicine. And
Shame.
I unfortunately, the way that I was trained, even though that I'm trained as a women's health specialist, we learned very little about helping women with hormonal imbalances. And um, at the same time, I was going through a very difficult menopausal transition myself, and I felt like I was being failed by my own, medical degree in
Sure,
college. And
definitely.
it was just so rough. And I just thought, there has got to be a better way to do this. So I just kind of, like used myself as a guinea pig and launched this whole investigation. And I guess that's where the suffering really brings about like this desire to change. So, what I learned was just so incredible and mind blowing. And, I really give a lot of credit to some of the women that came before us, Suzanne Summers, JJ Virgin, like
I
those
think
anecdotes
Suzanne
are
Summers
like
a lot.
all of the books that I read as I was trying to like figure all of this out, for myself. And, then once I, kind of found my own way, I just happened to find, a doctor that was more in the functional medicine space than in the mainstream medicine space that was a hormone specialist that really kind of, set me off on the right track. And it was just such a life-changing experience for me personally that, I just knew that I had to make the change myself. So, this was really meant to be a little like side gig passion project for me, that I was going to do a couple days a week. I had a friend that owns a med spa, and, I just asked her if I could rent some space from her. So that's kind of where it all started. I rented this little one room space and just kind of put my like business posting out there, and it has just, blown up from there. I had no idea how many women needed this kind of help. And
Agreed.
our area in particular, South Jersey, I feel like is so underserved. And we're a little bit behind in like what is the current information and education about hormones and hormone therapy that, women are falling through the cracks every day. So it's just kind of now become my mission to serve the women of South Jersey.
All right. Well, we're really glad that you went on that path because it definitely has made a difference in both of our lives. What would you say are some of the first signs and symptoms that someone may see when they need to see you?
I would say, now I think because of social media, everyone knows the word perimenopause. I think most women, have always known the word menopause, but maybe not so much perimenopause. So, the most important thing to know about that are what are some of the changes that you will start to notice when hormones are becoming imbalanced. And
Exactly.
for women, we have three sex hormones that really kind of run our body, where men only have one. We have three. So that's estrogen, progesterone, and testosterone. So perimenopause first starts when the natural decline due to the aging process of hormones starts to take place. And that can start generally around the mid 30s, so say 35 or so. Some women it's younger, some women it's older. But it really is characterized by the fall of progesterone. That's the first hormone that declines when perimenopause starts. Progesterone is our fertility hormone, where estrogen is the hormone that runs our menstrual cycle. So estrogen and progesterone are always meant to be in balance. But once progesterone starts to decline, is when we start to notice the hormonal shift. And that's sort of the onset of perimenopause. So some of the classic symptoms of perimenopause, mood swings and increased anxiety is a big one. And this is the kind of anxiety that you can't attach to a situation. It just kind of doesn't make sense. You've probably heard it as, mom anxiety or stress anxiety
Yes.
or
Mhm.
all of the things, right?
Or short tempered, as some people like to say it.
Yeah.
Or exactly. Everybody makes you mad. Everybody, like all of those kind of
Breathing.
things.
Yeah.
Right.
Chewing.
You want your kids to move out, you want your divorce your husband, like all of those,
Exactly.
Mhm.
right? And you don't know why. I think that's the basis of it all is like you don't feel like yourself, but you don't know why,
Right.
right?
Right.
And
I've been there.
um
Mhm.
one of the other things that this was a big one for me was insomnia. Like all of a sudden I couldn't sleep
Yes.
or I woke up and couldn't go back to sleep. And
Mhm.
like night after night after night, that sleep deprivation affects everything in your body. So that's a big one too. For some women, it is changes in the menstrual cycle. How many women have you heard that have these horrific, clotty, heavy cycles, that are now causing anemia or now, they're seeking help at GYN and they're told it's time for a hysterectomy or whatever. But in changes in the menstrual cycle is also a big one too. So those are kind of the top three sort of classical ones.
But do you see, it depends on the person that maybe one person, it could be hot flashes, the next person, it could be joint pain. Like is there any script that someone has to follow or it could be a variety of things?
It's definitely a variety of things, and it's definitely perimenopause actually happens in stages. So there's three separate stages. The closer you get to menopause, the more dramatic the symptoms can be. So where it starts off a little bit more mild, that's called stage 1 perimenopause. And then as things start to shift either further and further towards menopause, then we're entering stage 2. And that final stage is stage 3, which is really more of a transition from perimenopause into menopause. That's where we're seeing skipping cycles. That's where we're seeing, these erratic kind of mood changes that are even worse than what they were in the very beginning. Um, Worsening PMS symptoms is another one that, if you've always kind of had a tendency all of a sudden, like they're worse. And then also, of course, the brain fog and fatigue, those are big ones too. And then, the midsection weight gain, which I think, is probably what most women, the reason they come to see me.
Yeah.
In
That's
Yeah.
the one that throws them over
I know.
the edge.
And
You're like, I can be
Right.
a bitch, but
and I don't know if maybe if some of your patients say this, but I know friends, they're like, "Oh no, it can't be menopause or that not even the concept of perimenopause because they're like, I still get a period."
Right.
And I remember the whole discussion would
yeah,
be, well, that doesn't matter because your body's still fighting,
yes.
like it's still going through this process. So,
Yeah. Yeah. You can really be in perimenopause as long as 10 or 15 years. It can start that
wow.
early. So if you figure, you're starting mid 30s, but you don't actually go through menopause until early 50s or so, that's a big long span to have to deal with these kind of symptoms.
So
And
what about so if someone's coming to you for treatment, what age do you recommend? Is it a symptom based? And is there any age that's too old? Is there any age that's too young or any age that is too old?
um neither for both of those, I would say.
Okay.
I do see women in their 20s starting to experience early signs of perimenopause.
Mm.
There are a lot of triggers, I think, that are causing early perimenopause for some women. I think COVID was a big one, a big trigger for early perimenopause. I have several patients that like they lost their cycle altogether as a result of COVID. So, that's just one kind of instance. But the other thing that I do see that's kind of a shift from maybe even like 10 or 20 years ago is that women are choosing to have babies later in life.
Mhm.
So, they're
I would think.
choosing to wait right until their 30s to have babies, when that's also when perimenopause is starting. So I do have this whole like demographic of women that go from pregnancy, postpartum, and then into perimenopause, and their bodies never, rebound back to the previous, years. So, that can really throw women off, because, they'll go to their doctor and they'll say, I just haven't felt right since I had this baby. Right. And then what are they hearing? It's normal. You're just
Right.
postpartum. This
Mhm.
Right.
happened. It's all of that kind of thing, where they have some pretty significant hormonal imbalances.
Wow,
Right.
that's a great point.
And nobody's listening.
No.
So
So,
No,
good for you.
yeah. So what types of estrogen do you prescribe, and what kind of goes along with that whole process?
yeah, there's a really important kind of pathway that we kind of look at. We want to match up the hormone therapy that we choose with what stage of perimenopause that
Okay.
women are in. So estrogen therapy we typically reserve until closer to menopause, because estrogen doesn't start to decline until much closer to menopause. So you can make a good robust amount of estrogen really until your final cycle. Once we start to see more menopausal low estrogen symptoms, that's going to be more like your hot flashes, night sweats, vaginal dryness. Some women really struggle with painful intercourse at that time. So that's when we would be working with more with estrogen and estrogen therapy. So once we get to that point and we're thinking about adding hormone therapy for estrogen, then we want to focus on something that's bioidentical, that's not synthetic. So that's kind of the biggest misunderstanding I think out there, are the types of hormone therapy that are available. Some are synthetic, some are bioidentical. Bioidentical just means the actual molecule of medication looks identical to the own hormone that you're making, so that your body recognizes it as if you're making your own hormone again.
Okay.
S-
Good.
And then, so I guess early on, then it would be you're seeing for that early onset or even just early phase one perimenopause, it's more progesterone based.
It's more progesterone,
Okay.
right? Yep, that's when we're using progesterone. And we're doing it in a way really to mimic the body's physiology, because you don't make progesterone all month long. There's only certain times of the month that you make it. So we're really using it very targeted
Oh, okay.
toward that person's specific cycle. So we're trying to fill in the gap between what their body's not making anymore, but really what they need to create some balance.
Okay. I know that you do blood work for your patients. So, what would we maybe see in someone's blood work that would indicate that there's a hormone issue?
It's a little bit difficult and tricky to check blood work, just because the cycle is always changing. So we
Mhm.
do check blood work. I will always check progesterone levels, estrogen levels. There are two other hormones that we check that actually come from the pituitary gland, luteinizing hormone and follicle stimulating hormone. Those are the biggest markers where we see perimenopause and menopause starting to happen, because it's a reaction in the brain that is picking up that we're no longer making enough hormone, whether that's progesterone or estrogen, and the brain will crank that signal up, trying to force the body to make more of those hormones. So we see that in elevated numbers, which is an increase of that brain chemical happening. So and that's a marker that a woman's body will ask for until the day she dies. So our brain will always want estrogen in our body, regardless of how old we are. So that's a pretty significant marker, I think, for us to follow. It is also important that we check testosterone for women as well, as part of this, full scope of all of our hormones. We don't give testosterone enough credit for women's health. It is one of the most important hormones that women have. We actually make more testosterone than any other hormone that we make. So when it starts to decline, then we notice it. We just don't know that that's what we're feeling. And no one in mainstream medicine will talk to you about this at all.
So it's interesting that you said that because we had talked before. I read a great article in the New York Times about the importance of testosterone in women. The
Yeah,
comment section was like off the chart. The
yeah,
FDA, they said, has not done one study for testosterone for women. They've done 35 plus, I'm like
For men.
for men. But there are other countries like Australia has, they just developed a testosterone cream that's like for like strictly for women. And they've talked about all the other studies other countries are doing, but yeah, the US, and like it's kind of discounted and how it really complements all the other what you need like going through like perimenopause, menopause. So
yeah.
yeah,
Yeah,
it's
and
mhm,
testosterone, really, there are testosterone receptors on all of our organs. So, when there's not enough hormone to go around, then those organs aren't going to function at 100%. Right. So that's where we see a lot of mood changes, brain fog, depression is very highly associated with low testosterone. It's also important for our bones, our brain,
mhm.
body composition. A lot of times we'll see a shift in body composition, not the number on the scale, but like our body just doesn't look the same, even though we weigh the same. That's a low testosterone thing.
Wow.
What about like the A1C and, cholesterol?
Yeah.
How are they affected by hormones?
Yeah, they are greatly affected. Almost every perimenopausal and menopausal women, we see elevations in cholesterol numbers, specifically the total cholesterol and the LDL cholesterol. So, that has to do with cholesterol itself is the backbone of every hormone that we make. So our body needs cholesterol to function. So if there's not enough cholesterol to go around, the body will want to hold on to it because it thinks you need it to make more hormone. Right. So it's kind of this reflex that's happening. And then, unfortunately, we get tagged as, high risk, high cardiovascular risk, and now we need a statin,
Mhm.
right?
Yeah.
When that could be the furthest from the truth because the more we squash our cholesterol with statins, the less ability we have to make hormones. So it can actually make hormone imbalance worse.
Oh, wow.
Yeah.
No, I had no
They don't
idea.
really take
Yeah.
care of us, do
No.
they?
And
Yeah.
that kind of goes into our next question that we have for you is, and the same thing, we hear about it just talking to girlfriends all
Mhm.
the time, talking with one another, our own experiences, is that how often do you hear from your patients about misdiagnosis and the common diagnosis like a woman will receive from, regular
GP, yeah.
yeah, GP, or even gynecologist. That my first gynecologist, I remember the same thing, like telling her, like, I don't feel good, like something is wrong, like, and all this stuff is like happening. And she's like, be healthy, be healthy.
Yeah.
And I'm
Eat
thinking, I'm
nothing.
like, oh my God, I am. I'm like, I'm blessed that I am a healthy person, but this is like something totally different. So how about for the patients that you see?
Yeah, most of the time by the time that patients get to me, they've been to all of the specialists, right? And they've been told time and time and time again, this is normal, your labs are normal. This is just what happens to women. It happened for your mother, your grandmother, and they made it through. Just exercise more, eat
Just miserable.
better.
Yeah.
Yeah, eat better. It's just your stress level. You're a mom, you work, you're a wife, like it's always, unfortunately, it's always put back on us,
Yeah.
right? It's always like, I always walked away feeling like, okay, this is my fault because I'm stressed, or this is my fault because I'm not working out enough, or or I'm not eating the right thing. And so then it sends women down these rabbit holes of trying to fix themselves when,
Exactly.
Yeah.
there's really nothing they can do. Their
All the
body,
facts.
body's changing.
You saying that I have chills
Yeah.
because it is. It's like what you've
Yeah.
experienced. Like I'm doing something wrong. Like I'm not like good in like and that whole thing of like women and like moms always feel like I'm not good enough. I'm not doing that enough. And that really only compounds it. I do. I have chills that you just said that because
Yeah.
it really is the way you're made to feel.
Yeah.
Mhm.
Yep. It's very unfortunate. And it's really just, look, the mainstream medical field is doing what they know how to do. Right. But the one thing I think is really important for all women to know is that where you should go makes a difference when you think you're experiencing hormone imbalances. And, most people's first place to go is GYN,
Mhm.
right? And I mean, I can say this because I worked in that field. GYN providers are not trained hormone specialists. We
Correct.
think that, but they really are not, right? Or your OBGYN is a trained surgeon. They are trained to get you pregnant, help you have a healthy baby, get that baby out in a C-section if needs to be emergency, do a hysterectomy. Like that's really where most of their training is. They are not trained in any kind of hormone specialty. So, they are very good at what they're good at, but unfortunately, they've kind of been, that's where everybody goes because it's a hormone issue, right? Either there or endocrinology. Endocrine does not care about women's hormones at all.
Yeah.
So, there's just this gap that I always felt like once women are past childbearing, no one knows what to do with us.
And nobody cares.
No, they just
Except
push us
except
off
for
to
you.
the next person, right?
Right,
Yeah,
right.
so that's kind of where everything where the wheels fall off, I think.
Yeah.
Definitely.
All right. So speaking of, doctors giving different diagnoses, so do you have any advice for women who have either had breast cancer or uterine cancer that they're told you can't ever do any type of hormone therapy? What would you suggest for them?
Yeah, there's a lot of much more current information that I think I first of all, I think it's always important for women to advocate for themselves and for them to not just accept that as being, the only option that they have. And yes, in some cases that might be true, but there are a lot of misunderstood things about breast cancer or even history of breast cancer. I've had patients, being told that their mother or their grandmother had breast cancer, so therefore they can never have hormones, which could not be further from the truth. But
Right.
in general, once a woman goes through breast cancer and it's been 5 years, she's no longer taking any anti-estrogen medication and she's been discharged from oncology, that's really a clean slate for hormone therapy.
Okay.
A lot of the cancer treatments put women in chemical menopause, right? And it's quick, and they feel awful,
And it's
right? And
terrible.
Yeah.
yeah, it really is. And there's so many changes that happen in their body. Just the loss of estrogen to the pelvic organs, the vagina, the bladder, all of that. All of a sudden they've got a leaky bladder. All of a sudden, their vaginal dryness is painful. Like there's all of that kind of stuff. Even women who have survived breast cancer and are still within that window, there are other alternatives we have for working on some of those symptoms. Vaginal estrogen is not the dose is not high enough to enter the systemic circulation. So women with breast cancer can use bioidentical vaginal estrogen, and that really helps to work on some of that discomfort that they have.
Great.
We also can use DHEA, hyaluronic acid. There's a lot of things that we can use in place of, and some of this is going to depend on the individual woman's comfort level, with adding back
Correct.
hormones. Some of them are just too scared. At the end of the day, testosterone is not contraindicated for any woman with breast cancer, even if it's active. So that's another big misunderstanding. It's not a hormone that generates any kind of cancer cells or will grow an established cancer. So testosterone is safe to use. No one will ever tell you that either.
I like it. Right.
And
Yeah.
then that's a good, you just raised a really good point about, I saw about vaginal estrogen is actually helps women that maybe are prone to UTIs. I think so
UTI.
that's something. Yeah. So have you seen that?
Yeah, UTIs and stress incontinence, where they'll have that little bit of bladder leakage if they call for sneeze. So the bladder is coated with estrogen receptors. So
Yeah.
after menopause and even heading up there, when there's not enough estrogen to meet all of those receptors, the bladder kind of loses tone and it gets a little bit boggy, we call it. So it changes the way the bladder can empty. So when that happens, then there's a little bit of urine sometimes that can get caught in the bladder, leaving them susceptible to UTIs, and also for that stress incontinence kind of thing. So vaginal estrogen can be really helpful to restore that tissue.
Yeah, so I had no
Good.
idea. It kind of works with the same thing going through the pelvic floor. It helps with your pelvic floor health. I mean, you have the whole
Yeah.
exercise, but then that
Right.
I had no idea
I
that
didn't know.
hormones would
Yeah.
be involved. Yeah,
Yeah.
Well,
that's
that's
fascinating.
bladder fog. Mine's asleep, I
I
think,
know.
half the time. No.
And then, so in addition to hormones and like hormone treatment, what could you tell us about peptides and the kind of peptides that you prescribe to help women or help people in general?
Yeah, that's a really good question because I think peptides are kind of having a moment right now, right? And all that means, all a peptide is a string of amino acids in our body, and our body naturally makes its own peptides. Um, because of the aging process, though, so here we are back to the aging process, we lose the ability to make these peptides in the amount that our body needs for to keep us young. What I call that is more of a longevity thing, right? And so this is the other thing that we want to think about for women and for men is that, you're going to live as long as you're going to live. So there, you see the difference between someone who is really focused on longevity and living well and healthy as opposed to someone that's just sort of given up, right? And so that's one place that hormone therapy comes into play is working on that longevity piece. But peptides are another strategy that we can use to kind of augment what's happening with the hormones. And this is also a strategy for women that don't want to use hormone therapy and choose not to,
Yeah. Okay.
for whatever reason, they can use peptides in place of that. So the most common peptides are ones that we're using to stimulate our body's ability to make growth hormone. So growth hormone is what is the biggest hormone of repair in our bodies. So once we lose the ability to make enough growth hormone, and that's just an aging thing, that's when we start to notice our body breaking down, and things shifting and that sort of thing. So there are specific hormones that will stimulate the pituitary gland into making more of our own growth hormone. So I like the approach because we're not replacing anything. We're not replacing with growth hormone and shutting off our body's ability to make it. We're just enhancing, what our body is able to do. So one of the, of course, most common peptides right now are the GLP peptides that are used
Oh,
in weight loss,
okay.
right? That's a type of peptide, and that is replacing GLP is a peptide that our body makes. So that's one that is replacing our body's ability to make insulin more effective. So that's one area that it works on. You may have heard of a peptide called sermorelin. There's another one called, these are all fancy names, CJC 1295. That's a very popular
A
one.
friend.
Um, those are ones that are really giving us the most bang for our buck as far as what they're able to do with increasing growth hormone.
Okay.
Can you just go over like the best delivery methods for all of that as well?
Yeah, most of the delivery methods are going to be injectable form just because they don't get absorbed well enough through the gut. So there's only one that is really good for gut health. That's called BPC 157. That one is specific for gut health, but the rest of them, there's not enough bioavailability if you take them by mouth. So injectable form where we're bypassing, the delivery method of the gut is really where we get the most benefit. So that is important because you'll see a lot of, companies out there that are producing these peptides in a capsule or in a liquid dropper. And for the most part, like they may have a tiny bit of the active peptide, but they're not really in a dosing form that you're really going to get the benefit from it.
All right. Then what about the big uh I guess there's a on the NADs. There's like a
On
lot of talk
NAD.
about the NADs. Like
Yes.
they're like all over Hollywood. What
Hmm.
what, what can you tell us about them?
Yeah, NAD is also a something that our body it's a coenzyme. So it's not a peptide. It's a coenzyme that our body makes for repair. So
Yeah.
think about all of the breakdown that our body goes through every day. And this is sort of from the oxidative state where we have, I'm sure you've heard the word free radicals that are breaking down our cells. And, our body has to clear all of that out. So NAD's job is to help with that clearance and help with repairing our DNA. So again, it's something that we make less and less of as we age, so that healing process can take longer or not be as efficient. So NAD is something that is very essential for energy within the cell, repairing. It's called the mitochondria. That's the energy producing part of the cell. So that's what it targets. It targets the mitochondria for cellular repair, repairing DNA damage, and it works very, very well for brain health. That's mostly where we're seeing it kind of shine. They're using it a lot now in clinical trial for Alzheimer's and dementia, and really helping improve brain health, and that kind of thing. It is really good for fatigue, for brain fog. I've had success with it for some women with anxiety and depression where nothing else is really working. I've had a lot of success with it for chronic fatigue as well. So these are places that are a little bit tricky, like where, hormone therapy doesn't quite cut the mark for what we want it for. So that's where we would use, something like this. So it's a good kind of overall anti-aging, thing to think about. Also, I think it works best in the injectable form.
That's my next.
Yeah.
Yep.
Yeah, it does, because there's a lot of these out there now too, right? The same thing. Like it does come in a nasal spray. It comes in a pill you swallow. It comes in like a sublingual form. But we really do see the best results with injectable form, and that can be IV. There are some IV clinics that give it IV as well.
And do you see with the peptides, I mean, you're well aware, Chris is a big workout person. Like I work out, we're trying to, the same thing. We're trying to keep lifting, keep moving.
Doing all the things.
Yeah,
We do all the things.
with like the
Yeah.
same thing with even like recovery, kind of like the joint pain, that soreness. Okay.
Yeah, for sure. And I think we see big shifts in body composition with peptides. That's one of the things I think it's really good at, because it's so good for recovery. So it's really reducing that recovery between workouts, and that reducing like the fatigue and also the joint pain that's associated with that. I think we see a lot of change there. So it does allow you to be more efficient and effective, I think, with your workouts.
Oh, that's
Great.
interesting.
Great.
Hmm.
All right. What are some signs that the man in your life might need some hormone help?
Okay, let's talk about they don't get out of this scot free.
That's
Um,
right.
the thing about men, like although we do have some mainstream providers that will prescribe testosterone for men, they are also very, very undertreated and undermanaged as well. So there's a lot of people are very scared to prescribe testosterone for men. Unfortunately, what is considered to be a normal level of testosterone for men is something that the insurance company decided on that doesn't really line up with what is adequate for a man. So, they may go to endocrine, or they may go to urology, and somebody will prescribe it for them, but insurance will only pay for it if it's under a certain number, and then they'll only pay for enough to get them just over that number, right? So we're not optimizing them at all, right? So it's real. Sometimes they even feel worse, or they feel good for a couple days after their injection, and that's it. So, there's a big difference between optimizing your body and just doing what's normal, right? So that's kind of where, we kind of choose to work more in that optimal space where we're really, helping them get their testosterone to levels that they really feel good. Their body works its best and they feel good. One of the biggest signs in men of low testosterone is depression. And that can happen as early as their 20s or 30s. And they get put on antidepressants, anti-anxiety medication all the time. And it's really more due to low testosterone than it is anything else. You'll see them get loose focus. They'll get very grouchy. They tend to get angry because they don't know how they're feeling. So they kind of lash out like that. I feel like is a very misunderstood thing.
Like children.
Yeah. Yeah.
I'm sorry.
At the end of the day, men are very simple creatures, right? So that's why they have one hormone and we have three. So,
I was thinking that.
I'm sorry.
right. And they get, fatigue, low libido, muscle loss, that midsection weight gain. If you ever see a guy like with a big beer belly and these little skinny pencil legs, that's walking low testosterone,
Yeah.
right?
Okay.
That's kind of
We're pointing out on the beach.
what that looks for.
Okay.
Yeah, they're brain fog. Like they really do have a lot of those symptoms. And when men lose testosterone as they age, it really does put them at much higher risk for cardiovascular disease, Alzheimer's and dementia, like these things that men are starting to, suffer from as they get older is really due to that, loss of hormone.
Wow.
Yeah. No.
Well, Susan, I have to tell you thank you for empowering women like during this very challenging and difficult part of their lives. So, like it, first of all, so thank you for what you do and like taking that on and really, giving women their power back. So that's awesome. And thank you very much for, just sharing with us. I'm like, I learned so much today.
I know.
Like,
I
I'm
and
thinking
I
like,
I see Susan and I
yeah.
learned more today.
So this is really awesome. And so you were like the best first
Yeah.
guest that we could ever have.
Yeah. So thank you so
Yeah.
much for
Oh,
that. I
thank
So
really
you. That's
appreciate it.
yeah.
yeah, I appreciate the opportunity really just to share with women because, at the end of the day, I can't take care of everybody, so it is really important that women act as their own advocates and inform themselves as much as they can and really like look for a provider that's a specialist and not get discouraged when when they're turned away. Because that will happen. Even my current patients, when they go back to their provider, they think they're crazy for going this route. But
Where can people find you, Susan?
so our practice is located in Hamilton, New Jersey. You can check out our website, balancedhealthnj.com. We're on Instagram, we're on Facebook. We do have a process for becoming a patient in our office, and that's something that we can go over. Our website explains it, but anyone can call and see what that process is. Unfortunately, this is not the kind of specialty that insurance pays for, so it is out of pocket for,
Yeah.
for most of our patients. So that's something that I think, if I could change anything, it would be that, that one thing, because all women deserve this kind of care.
Yeah. And you would think the benefits, health benefits that they have in the long term.
Outweigh.
Yeah. And I mean, talk about like saving money. Then you're not like then you're not using
Yep,
your insurance for all these other, health issues that you could have by
that's right.
stopping it through hormones.
That's the work smarter, not harder.
Yes.
Yeah.
You could be saving a
Yep.
lot of time, a lot of
Just
time.
not there yet. We're just not there yet.
Correct.
We're working on it right here, right now. We're
Yeah.
working on it. So,
Right.
thank you again. And thank you to all of our listeners. We hope that you please continue to like, share, and subscribe. Keep sending your ideas. We'll get to them in time. We got a lot going on our list. So just keep sending them and we're going to add them in there. So thanks again, Susan. It was
Thank
really
you.
awesome to spend
Yeah,
this
so
time with
nice.
you.
So nice to spend time with you girls. I appreciate it.
Thank
All
you
right.
so much.
Have a great day.
Yep,
Take
take
care.
care.